Hello, my name is Judith Edwards. I'm a postgraduate research student at the University of Surrey, and I'm going to present some data from a self-report audit of prescribing and medicines management activities undertaken by paramedics with independent prescribing qualifications in primary care in England. This data comes from my wider PhD, which is a mixed methods multiple case study exploring the implementation of paramedic prescribing in primary care. I just want to acknowledge my supervisors, Mr. Andy Collin, Professor Melaine Coward and Dr. Nicola Carey. So a little bit about the background. In 2018, the UK became the first country to legislate independent prescribing rights to paramedics working at advanced practice level. Independent prescribing, as opposed to dependent or collaborative forms of prescribing, where the input of a doctor or other independent prescriber is required, affords responsibility to a trained practitioner for the initial assessment, diagnosis, prescribing and management of medicines, and allows clinicians to prescribe within their professional scope of practice and individual competence. To be eligible for non-medical prescribing training in the UK, paramedics must be working at advanced practice level. They must have a clear clinical need to prescribe and should have or are in the process of undertaking master's level educational attainment. So following legislation in early 2018, the first non-medical prescribing programmes opened in England to paramedics in late 2018, and today there are over 1,000 paramedics with the independent prescribing qualification who are able to autonomously prescribe from the full range of licensed and unlicensed medicines, with the exception of controlled drugs. Now, while paramedics have long been able to administer a range of medicines under specific legal frameworks in the UK, independent prescribing is a new innovation and skill to the profession, and its contemporary nature means little is known about how it's being used, particularly in primary care. So this data, which is collected from the wider study on implementation of paramedic prescribing, represents a subset of self-report audit data collected by paramedic prescribers in general practice. Methods. So a bespoke electronic tool that paramedics could access remotely was developed and specifically designed to collect data in three main areas, including data on consultations, on prescribing and medicines management activities, and on information provided to patients about medicines. Paramedics were asked to record every time they undertook a prescribing medicines management activity from a list of 9 activities, for example, when they prescribed a new medicine, when they undertook repeat prescribing, undertook a medicines review, adjusted a dose or drug according to protocol or the BNF, or when they made a recommendation to another prescriber. Data on medicines information was collected from 12 items, which were grouped into how medicines worked, how to take them, and contraindications and side effects. Between March and May 2021, 5 paramedic prescribers at 4 primary care case sites used the tool to collect data during consecutive patient consultations across the equivalent of 1 working week or 37 hours. Descriptive and inferential analysis was undertaken using SPSS version 26. And a little bit about the paramedics. There were 4 males and 1 female. They had an average age of 34 years and had been working in primary care for around 3.5 years. 3 provided same-day unscheduled care for minor illness and general practices, and 2 worked in a GP referral rapid access community home visiting service for housebound older adults. The length of time qualified as a prescriber ranged from 2 months to just under 2 years, and 3 paramedic prescribers held master's degrees. So results. Consultations. So case site paramedics in total recorded 246 audits, each collecting data over a median of 6.5 days, and the 246 audits representing 63% of all consultations during the data collection period. 92% of consultations were unscheduled same day, and 8% were pre-booked. 75% were delivered via telephone, 15% were home visits, and 10% were delivered in clinic. The episode of care was completed in 71%, with 26% of patients requiring follow-up and a further 3% needing hospital review. So results, medicines management activities. There were 214 medicines management activities recorded in 154, or 63% of consultations. New medicines were prescribed by paramedics in 99 consultations, or 40%, equating to once every 2.48 consultations. Paramedics recommended over-the-counter medicines in 16% of consultations, and repeat prescribing was recorded in 8%. The most frequently prescribed medicines were antibiotics, antifungals, analgesics and antidepressants, bronchodilators and corticosteroids, and laxatives and antiemetics. Results, medicines information. Paramedics provided information on medicines in 137, or 56% of consultations, equating to information given every 1.8 consultations. These included 91 of the 99 prescribing consultations. In the consultations with prescribing, paramedics gave a median of 6 items of information. 89% of patients who received prescribed medicines were given information on how to take them, 87% were given information on how they worked, and 78% were given information about side effects and contraindications. Now, looking at any differences between paramedics with master's degrees versus those without, overall, paramedics with master's degrees were more engaged in independent prescribing and medicines management. They recorded more consultations with medicines management activities. They prescribed more frequently. They provided a wider range of activities. They gave a wider range of information, and they were more judicious with their antibiotic prescribing. The electronic audit tool was highly acceptable and accessible for capturing data on paramedic prescribing and medicines management, and may have applicability to other non-medical professions with prescribing rights. Paramedics demonstrated similar levels of involvement in medicines management and antibiotic prescribing to other primary care non-medical prescribers, suggesting they're using independent prescribing in line with policy objectives for improving medicines access. And the study provides preliminary evidence to support the extension of paramedic prescribing rights in primary care.